Well, we are the men and women for others. The way we serve others is we work in the hospital in the emergency department. We use the skills that we've learned through our training, coupled with the education we've received from our Boston College courses, and we tie that in with whatever personal experiences we have to effectively screen anyone seeking help who comes in the emergency department. We're a small group of undergraduate students.
And it's completely student-run, and it's completely volunteer-based organization.
We're a pretty diverse group. We come from all sorts of different backgrounds. We're studying different things.
I get to hear other screeners talk about their encounters, and I feel like I'm still learning so much from just what they say and being allowed to ask them questions and critique them.
When we go to the hospital, most of the patients that we do screen happen to be BC students. These students that come in for alcohol use and substance use problems generally are confused about their whereabouts. They're generally nervous, anxious, concerned about consequences at Boston College.
They may be very limited in what they say to a physician because of judgment, professional judgment, or their own family member because, again, it's personal. There may be a shame involved with that.
We walk in, we have a connection immediately. I'm a student at Boston College, and there is that immediate sight and feeling of relief that the students have.
It's very easy for a college student to relate to another college student. And even if we're not relating to a college student, let's say we're relating to a community member, it's much easier for someone who's not in a position of authority to relate to them than someone like a doctor or a nurse who they may feel intimidated by. One of the most common questions I get asked in the beginning of the screen is, do you know what hospital I'm in? Clearly the doctors and nurses know the answer to this. They all know they're at St. Elizabeth's. However, why hasn't the patient asked them? This is because they didn't feel comfortable asking them questions. They just felt like all they were there to do was to receive treatment and be asked questions of them. We really give them a chance to have the patient express themselves and ask questions of their own.
They know that there's someone there to answer their questions and to kind of help them out while they're in that difficult situation.
Screening patients is a unique opportunity to hone your communication skills.
You learn how to listen very intently to what people are saying and reflect it back to them in a positive manner. There's a big need to pay attention to people's feelings, what they're actually saying, their body movement, what they exude outside of just their verbal communication.
Anyone who comes into the emergency department, they need something, but different patients need different things.
This patient contact, you're really creating rapport with the patient. You're getting to know them, they're getting to know a little bit about you, and you're really allowing them to open up to you. And I really think that this ability to build this rapport will work well with bedside manner as I go on, hopefully, to medical school.
Professionally, the SBIRT Collaborative has definitely opened my eyes to the avenue of preventative health. And now when I'm looking at medical schools, I have a special eye out for those that offer a joint program in Masters in Public Health.
The SBIRT program has helped me picture the healthcare environment at the hospital.
As far as the timing in my academic career, I don't think it could have come at any better time. As a freshman, getting a kind of undergraduate experience, that's really key to me before moving on to a career in healthcare.
But SBIRT really changed the way I looked at healthcare.
I've taken a lot out of the SBIRT program. It's trained me in a lot of the clinical setting and how to interact with nurses, with patients, but it's more than that. You get to think about a lot of philosophical ideas that you might not necessarily consider when you see someone who's been homeless for 30 years and has been depressed for the last who knows how long.
Through the SBIRT program, you can see that these people, they're just like you and me, and a lot of them have been put through really hard circumstances, and a lot of times it's either a cry for help or it's something small that it's been working at them, or something big that no one else sees. It's sort of made me take a second and think before I judge people too quickly.
I'm really happy I took this opportunity, and it's opened my eyes to different paths.